if you want to set up a shared service centre or incorporate your PCN, as it's called, you've got to think about the structure and the way it works. So what is it? You've got to start with what is a PCN? Well, the PCN is the core network practices, however many you've got, be that 2 or 10 or 15. What they define is the geography of the PCN, because that's the sum of the practice areas, and they define the population, the 30 to 50,000. So those are the core network practices which form the core of the PCN. Now, there's a reason it's called the core network practices, is because that isn't actually the PCN. Common mistake is to think that they are, but they're not. The PCN is bigger than that. The PCN is the core network practices plus any other members who you want to admit. And so you could admit people like community health, mental health, community pharmacies, whoever you can think of who delivers health and care to the defined population in the defined geography. You can admit. You don't have to, but you may well choose to do so, because if essentially, remember the real purpose of the PCN, and this sometimes gets forgotten about, I think, in all of the sort of people talk about the problems and everything else. But what's the real purpose of the PCN? It's actually to improve health and care services for the 30 to 50,000 patients. And you can do that by working more closely together as practices. But if you want to make a real difference, you've got to work with the other organizations, the other entities who provide health and care. The real PCN is actually this big block here. It's the core network practices plus the other members. So that's your PCN, and you have your PCN schedules, PCN agreements, which set out the rules of how you work. That doesn't change. That doesn't change at all. What you do is you actually add to that. And what you add is a PCN company, or a shared service centre, call it that, but it's in the form of a company. And that company is owned by the core network practices. It has nothing to do with the other members of the PCN. It's just owned by the core network practices. They logically would be shareholders in the company, and in that way they become members or own the company. So you set up a company owned by the core network practices, and then you move all of the PCN activity, but only the PCN activity, so all the R's resources typically, but potentially other things as well, into that company. In many ways, what it does is it rolls back the activity from within in the practices to where they were before PCNs arrived, because you've still got all your ordinary staff there and all your ordinary GMS activity, but the PCN activity, so the R's resources, move into the PCN company, and the PCN company supplies those staff and other services back to the core network practices. So what you do is, instead of having transactions between practices, you then have transactions from the shared service centre to the practices. Now you think, well, that's a bit of a funny thing. Why would you bother doing that? Well, it's a number of reasons why, and one of them is what we call a VAT cost sharing group. So if you set up your shared service centre this way, you can create something called a VAT cost sharing group, which is that red line around the core network practices and the PCN company. So long as the PCN company is providing the services to the core network practices, all of the activity within that sort of big red circle is outside the scope of VAT. So instead of worrying about whether a Jaffa cake is a cake or a biscuit, you really couldn't care. You still just eat it. It just takes the whole lot outside the scope of VAT and resolves the VAT problem, so long as you follow a series of simple rules. And those rules are that the company must be owned by the core network practices, which it will be. It needs to be directed by the PCN representative. So the PCN, getting the governance right around this is key. So what you need to do is think through, how do I avoid this company developing a mind of its own? and going off and doing other interesting things that companies can do. And that you do by making sure that the governance of the company, in particular the directors and the shareholders, are actually the same people as the PCN representatives. If you make it that simple, PCN representatives equals shareholders equals directors, then the company is just doing what the PCN representatives want it to do, and the PCN representatives do what the practices want it to do. So by keeping it that simple and tying the governance between the PCN and the company, it just becomes a shared service centre. You then move all of the R's resources into the company. By the way, the company will be eligible for the NHS pension, because you can, what you do is you apply for something called NHS pension dispensation. And when this first started, it wasn't possible to get this, but this is now possible. You apply for dispensation, and all the resources which are in that company can get the NHS pension, which is super. So that solves that problem. You then move all of your other contracts into that company as well, if that was, you know, subcontracts or leases or whatever it is. So basically you move all of your costs, your PCN costs, into that company, and then the company supplies those services, be that R's resources, be that space in a lease, be that a subcontracted mental health worker, whatever it is. They get supplied at cost, and it's really important to remember, at cost back to the practices. So from a flow of money perspective, PCN money comes in the DERs at the top into core network practices, and into a nominated bank account, and then from there the nominated bank account pays the company for whatever services is provided at cost. As long as you do that, then you are within the scope of the VAT cost sharing group, and all of your problems there are solved. Neatly, this isn't some HMRC solution to PCNs. What it actually is an HMRC solution to the fact that some businesses like yours can't recover VAT, which is unfair, because businesses like ours can, but you can't, and so therefore it's not fair, because you can't set up shared service centres. We can do it, because if we set up a shared service centre with somebody else, like with Wesleyan, well, Wesleyan and DR Solicitors are both VAT registered. We can both recover the VAT. So to be honest, we don't care if we generate VAT. You do, because you can't recover it. So this is an exemption which is designed to enable sharing between organisations like GP practices. So think about that. That means that anything else you fancy sharing as well, you can also put in your shared service centre. So if you fancy doing a shared back office, or buying products together, or buying insurance together, or whatever you fancy doing, you can do it through the shared service centre, and that can get you economies of scale. So that's a really useful little additional benefit of doing this. And then what you do is, if you do manage to generate profit in that, which of course you shouldn't do on year one because of that cost sharing group, but future-proofing it, you've now got an entity which could contract. And if it contracted and decided to, let's say you get a contract at PCN level, which remember is going to happen because all of the money is flowing to PCNs, you get a contract at PCN level, you may decide to start delivering services through your company, which nobody's nothing to stop you doing that. You then generate profits in there, and then you need to think about how you get that money out. So you do that through dividends, through something which we call alphabet shares, which enables you to have different dividends for each practice, and then you can just share the profits out based upon list, so long as it's set up properly, or indeed upon any other basis you've got. So by structuring it, you can A, benefit from the VAT cost sharing, and B, you can get you can solve many of your other risks. So this is the structure. This is the structuring option of setting up a shared service centre. Incidentally, this is also the way that if you go down a federation model, that's actually also what's going on in the federation model. The only difference is that the governance is different, because instead of having the PCN representatives the same as the directors, so you have one meeting and make the same decisions, those are different. So the PCN representatives make a decision, then go to the federation and say, can we do this? But other than that, the basic structure is the same, which is why through a federation you can get the same benefits.